Right. Good evening. It's supposed to be interactive. I've read the programme. You may not, but it's so good evening and welcome. You've already heard I'm Derek Bell. I've got the privilege of being the president of this college for at least another few months. And you might wonder why physicians in white public health. Well, I think public health, population health is the responsibility of all of us, both individually and collectively. And some of I'm just going to do a little bit of history to the college. Some of you won't know the college was founded in 1681, but some of the founding principles of the college were related to making sure that the poor of Edinburgh had access to drugs, and to be a fellow you had to participate in dispensing to the poor. Members of our fellows of the college were responsible for some of the reforms that took place in and around Edinburgh, including the setting up of mental health hospitals. Now, we may think that's passé and that's out of date, but if your option was being in a poor house chained to the floor, possibly an asylum was a better option at that time. So not necessarily the right thing for now, but some of these changes have been at the background of the college, and I think increasingly of late, through a number of people who are in this room this evening as well, they've made sure that the college has had an interest in some of the public health issues, not just affecting Scotland, but affecting the UK and indeed internationally, including tobacco, smoking, food industry, diet, and other aspects of that, including exercise. But one of the things that does affect us all is inequity and not access to health and care that is everybody's human right, according to what is affordable or accessible within their country. So the fact that Scotland is entering into a new period of public reform, health reform, is a huge opportunity for Scotland in terms of getting it right for the people and for the relevant communities. And you've already heard from Mark around that we are delighted to be able to work and support this in a partnership model, not only in providing some facilities, but actually in making sure that the messages that come out of the public health reform are actually communicated well and by us and indeed by others, and looking forward to how much we can support this. So I'm going to stop there because it's really my job to introduce the main, not introduce, but be followed up by the kind of main speakers of this tonight, Marion and Jim, but just to sort of make sure that everybody understands our support, but also that we're here to listen generally, not just tonight. And I would encourage you to make sure that you participate in the discussion. One of the things about any meetings like this is actually the discussion is to some extent more important than some of the content at times. That's when people learn about what other people's thoughts are. So I would strongly encourage you to use the significant amount of time that's been left for discussion. So thanks very much, and I'll hand it back to Mark. Thank you.
Thank you, Derek, and again, thanks for all your support, and including supporting and getting our messages out about reform and ensuring that we are building an alliance and a collaboration across a whole range of colleagues in terms of supporting our reform ambitions. I'll now introduce you to Professor Marion Bain, Executive Director of the Public Health Reform Programme, who will maybe take us through a bit of a background on reform.
Thanks, Mark. So I'm just going to give you a very quick update on public health reform in Scotland. So to start with, what's public health? Now, this definition of public health, I think, is one of the best definitions there is. It was coined by Sir Donald Aitchison in the late 1980s. And what he said about public health was that public health is both the science and the art of promoting and protecting health and well-being, preventing ill health and prolonging life through the organised efforts of society. And then perhaps more practically, what is public health? Well, it's about what we as a society do collectively to really make the conditions in which people can be healthy. So, what then is the public health challenge for Scotland? Well, we have a significant public health challenge in terms of our health in Scotland. If we look at Scotland's relative position, we find that we're not in a good position at all. We're in the unenviable position of actually having the poorest health in Western Europe, so illustrated here by our average life expectancy. And then you see it again compared with other UK countries. And then not only that, health in our society and well-being in our society in Scotland is not equally shared. So we have these very significant and persistent inequalities in health through Scotland. And so if you look at people who are living in the most deprived circumstances in Scotland, you find that at all levels they experience worse health. So they die sooner of things that are preventable. They have worse health through their lives, and that applies not just to physical health, but also to mental health. And if we, this particular statistic I think is really, really striking when you look at it. If we think of healthy life expectancy, so that's the number of years that a newborn baby could be expected to live in good health in Scotland, if you look at the difference for that baby being born in the most deprived 10% areas of Scotland compared with the most affluent, you're looking at about 23 years worth of difference. So 23 years of difference between the most deprived and the least deprived in our society. So in terms of a public health challenge, we're looking at a situation where, yes, Scotland's health has been improving, and that's good, but it's not been improving fast enough to change our relative position. We're still there at the bottom of the league. It's not equal for everybody across society, and actually, even when we look at the improvements, the most recent data indicates that those improvements are now stalling in Scotland. So we have a major challenge in terms of our health. And then, of course, alongside that, people are living longer, and we've got more older people in the population. And as people are older, they have more complex conditions, they have more health conditions. And so we're seeing these pressures on our health and care systems, which really are starting to be unsustainable over time. And then just lastly, in terms of context, when we think about what actually determines our health, well, the NHS obviously is really important for us. It's particularly important when we're ill. But if we think about actually what determines our health and well-being, it's other factors which actually influence it more. So our genetics, the environmental factors round about us, but most importantly, the social and economic conditions in which we live. So that's our public health challenge in Scotland, and it's a significant one. So then, what's public health reform? Well, just thinking about public health, when we think about public health, we can think about it in lots of ways, but one of the ways we can think about it is like a series of waves. And if you look back into the middle of the 19th century, public health has evolved through a series of waves, with each wave building on the previous wave. And each wave of public health has been able to think about what are the key health challenges of the time, what are the key public health challenges, alongside what's society like at the time, what are the opportunity for addressing those challenges. And so when we look back into the mid-19th century, the major challenges were structural ones. And so public health was all about then making sure people had clean water, that they had sanitation. And then moving forward through to the end of the 19th century and into the 20th century, at that point, infectious diseases were a major public health problem. They were killing people at all ages, they were killing children and babies. So the next wave of public health, if you like, was round about biomedical wave, thinking about immunisation to prevent infectious diseases and antibiotics to treat them. As we moved further through the 20th century, a real awareness of how we live our lives and our lifestyles and how that affects our health. So whether we smoke, how much alcohol we drink, whether we have a healthy diet, whether we exercise. And so there was a focus on those lifestyle-related factors. And then most recently, this awareness that really our social and economic circumstances define a lot of our health. So those are the waves that we've seen of public health in the past. So what is public health reform? Well, it's really the opportunity for us to shape and deliver the next transformational change, the next wave of public health. That's our opportunity in terms of public health reform. So what would that next wave look like? What is modern public health? What is it that is there that can respond to the challenges of the 21st century and will take on board society as we have it just now and the opportunities that there are for us available to us? So modern public health is really all about how can we build this culture for health in Scotland? How can we build a culture of health so that everything that we have helps us to be healthy? Everything that we have promotes our well-being. So environments that support health and well-being for all, where it's easy for healthy behaviour to become the norm and people are then able to take responsibility for their own health. So it's how do we build a society where the society is all about promoting that well-being. Our organisations are designed and equipped to promote health, and that all of our environment is there to support that. And obviously to do that, it's fundamentally important that we all work together. So this is about how does the whole system do this? This can't be done by one part of the system. It needs all parts working together. So public health reform, in terms of the programme of work, has had 3 specific actions defined for it, and these were set out in the Health and Social Care Delivery Plan, which was published just right at the end of 2017. And so those were to establish national public health priorities, to create a new national public health body, and to enable a joined-up approach to public health at a local level. So those were 3 specific actions that Public Health Reform Programme was tasked with taking forward. So in terms of Scotland's public health priorities, these were published in June of last year. And in terms of defining those, there was a very broad engagement all across Scotland and also a consideration of what mattered to local communities, to local people, alongside looking at what the evidence tells us about what we should concentrate on. And what the Scotland's public health priorities are they are a consensus on the areas, the 6 areas, where we should concentrate our efforts together if we're going to make the biggest impact on health and well-being in Scotland over the next decade. And they are that we have vibrant, healthy and safe places and communities, that we have a sustainable, inclusive economy with equalities of outcomes for all, that we flourish, all of us flourish in Scotland in our early years, that we have good mental well-being, that we reduce the use and harm from alcohol, tobacco and other drugs, and that we eat well, have healthy weight and are physically active. So that's the consensus about the areas which are most important for us to focus on across the whole system in order to make the biggest impact, the biggest change in terms of our public health challenges and improving health and well-being for people in Scotland. The second action was round about a new national public health body, so that's Public Health Scotland, which is going live on the 1st of April next year, and you're going to be hearing more about that in just a minute from Professor Jim McGoldrick. But the Public Health Scotland will be really important in terms of providing support and leadership for this agenda. So it will have some core functions round about improving health across the system, protecting health, so protecting people from things that might harm their health, and also making sure that we design our services, our NHS and our care services in a way that promotes the best possible health and well-being. But it's going to have some new functions as well, new functions round about public health research, also round about innovation, which will be vital if we're going to make the changes that we need to make, and about supporting the broad workforce that can affect health in Scotland. And also, it will have very much as its foundation data and intelligence. And that's really important when we think about what some of the levers for change might be as we go forward. What do we have in the 21st century that could be used as one of the ways to really achieve that change in health and well-being that we want? And one of those things is the major developments around about data and innovation and technology. So that's Public Health Scotland. And then the third action was round about the joined-up approach to local public health action, We already have across Scotland community planning partnerships which have the main agencies and bodies all round the table. They will be the public health partnerships going forward, and those are starting to think now about how we will do that, thinking about what's required in order to take that forward, and starting to think about how they take the priorities that we've defined for Scotland in order to do that. So the question then is, what next? We've got the building blocks in place. We have now agreed what are our major challenges for Scotland, what should we be concentrating on. We've got now a body which will come into being to provide support and leadership. We've agreed that the whole system needs to work together. Importantly, we've got the commitment and joint ownership of both national government and local government in terms of taking it forward. And we've seen a wide commitment across the sectors. In the engagement work that we've done, it's been hugely encouraging to see the different sectors coming together and working together on this. So we've got a great starting point, but those things in themselves are not going to be enough. So the question is, what else is now needed to take these things and really make this change happen? What else do we need to do to genuinely get a culture for health in Scotland and achieve the change that we all want to see? So I'm just going to finish with a couple of graphs and a quote. So this graph just shows and illustrates the improvements that we've seen in health since the mid-19th century. So we've seen a huge improvement in Scotland's health. And so it's important to say that although we've got challenges about Scotland's health, we should be optimistic that we can do something about it. At each stage, each of the previous waves, there were huge challenges, and people did not know how they were going to address them, but they worked as they could at the time in order to deliver the change. So we should be optimistic that we can achieve the changes in terms of that next wave and really improving Scotland's health. And my second graph just shows life expectancy in Scotland compared with other European countries over time. So it shows from 1900 up to up to just beyond 2010. And at this far end here, you can see what I showed you at the beginning. There's Scotland. It's life expectancy, so the higher the better. Scotland's there in red right at the bottom compared with the other European countries. But I want you to look back a bit. 50 years ago, that wasn't the case. 100 years ago, that wasn't the case. So at that point, Scotland was much more like nearer the average. So what that tells us is that it's not inevitable that Scotland is unhealthy. It's not something about being Scottish that means that we're not healthy. This tells us that that's not the case. So again, we should be both optimistic and ambitious for the change that can be achieved. I'm just going to finish now with a quote. So there was a paper in the Lancet a few years ago really looking at this whole idea of a new wave in public health improvement, and it started to talk about this culture for health in Scotland. And what they said in the summary was this particular quote, which I just want to finish off with. And in terms of achieving this change, this culture for health, it said, this will require a positive, holistic, eclectic and collaborative effort involving a broad range of stakeholders. So, thank you.
Thank you, Marion, and I think that's a really good overview of the journey that we've been on over the last 18 months in terms of reform programme. So to get to where we've got to has been a kind of journey where a whole range of different people have been engaged in that conversation and have helped to shape that journey moving forward. But we're probably the kind of most exciting part of that journey just now with Public Health Scotland, as Marion had mentioned, planned to go live and scheduled to be operational as of April 2020 next year. And that will be a huge milestone in our reform journey. And it'll be another opportunity, I think, in terms of thinking about how do we build that collaboration, how do we engage that broad range of stakeholders, how do we build those partnerships to try and foster some of the change that Marion has alluded to there in the presentation. So I'm going to ask Professor Jim McGoldrick to kind of set out some of the thinking and the progress and the background to Public Health Scotland as part of our reform journey.
Thanks very much, Mark. So, I'm Jim McGoldrick. I'm the Shadow Chair of Public Health Scotland. And you might be puzzled about why I'm called the Shadow Chair. It's because it doesn't exist as a legal entity yet. So, we think in about 2 or 3 weeks' time, an order will go before Parliament to create a legal entity called Public Health Scotland, at which point I come out of the shadows and become an interim chair, because the organisation doesn't become real, as colleagues have said, until the 1st of March. But I just thought it might be helpful for some of the colleagues who may not know me, and there's no reason why you would, but say what my mum used to call, tell them your credentials. So up until 2 months ago, I was the convener of the Scottish Social Services Council, which is the regulator for the social care and social services workforce. So I did that for 6 years, and as part of that, and again, it's part of the whole system thinking that we've been talking about, I was also a member of the Care Inspectorate Board, and the Care Inspectorate Board Chair was also a member of our council. And it's about that mutual learning from each other. Prior to that, I was the chair of the board of NHS Fife. And in that capacity, I was a member of the Fife Community Planning Partnership Board. Again, some of the key players that we've heard mentioned before. And in that capacity, I was chair of the Fife Health and Wellbeing Alliance. And what really excited me about taking this job is that some of the things that frustrated me when I was chair of that alliance was trying to do things on a whole system basis. To work with the council, to work with the voluntary sector, the third sector and the independent sector was one of the big challenges that we had there. And when I saw the reform process about genuinely trying to talk about what a whole system actually means, I was very, very attracted to doing this. But what it also indicates that I'm obviously a person with quite a lot of capacity. So that's a joke. But, yeah, I'll signal it a bit better next time. But I think one of the key things that as I said, that from Marion's slide and from some of the slides that I'll be going through, is about the whole system. This is a job for Public Health Scotland. It's a job for all of us. And I think that's one of the key messages. And now I just want to show a brief clip that says a bit more about Public Health Scotland.
The health and well-being of the people of Scotland faces 3 major challenges. Our relative poor health compared with the rest of Western Europe, significant and persistent inequalities, and unsustainable pressures on our public services. To help meet these challenges, the Scottish Government and COSLA are creating a new national public health body, Public Health Scotland. The organisation will provide strong leadership as Scotland's national agency for improving and protecting health and well-being. We'll work with national and local government, the NHS, existing partnerships and the third sector to better support communities. We'll drive change through the innovative use of data, intelligence, research and evidence. We'll work collaboratively and will provide effective support for healthcare, health improvement and health protection. Public Health Scotland's values have been shaped and agreed by people and organisations from across the country and will define how we work. We'll be accountable to the Scottish Government and COSLA for driving improvements in the nation's health, and for working with local and national partners, as well as the wider system, to make a difference in our communities. Our ambition is for Scotland to be a world leader in improving and protecting health and well-being, and Public Health Scotland will play a key role in making that happen. We'll use our highly trained staff, new ways of working and strong lasting partnerships to develop the best solutions to tackle Scotland's public health challenges, both now and in the future.
So here are some of the ambitions that we've set out for Public Health Scotland. Emphasising what was in the clip around evidence, expertise and leadership. We start out with ambition. And I think, to pick up from what Marion was saying, in her presentation, and optimism for what we're trying to achieve. Again, the emphasis is on the whole system, and I suppose another thing in this formative phase of Public Health Scotland, these are the ambitions that we have at the moment. I see that these will evolve and change over time. But also, I would expect that when the new organisation is created and it begins to operate, these are the ambitions. We will be asked to translate these into outcomes, to achievements, and demonstrate impact. And I think that's one of the big challenges that I think the organisation will face as it develops, is can you live up to your ambition? That will be the big challenge for the board. And by the way, just while I'm on that, talking about the board, an advert went out on Appointed for Scotland's website last Friday, a week past Friday, and we're recruiting, very good news to report the progress, recruiting our new board members in the coming weeks and months. Again, the emphasis on leadership, evidence and collaboration. One of the challenges that I think that Marion indicated, and it would be, again, from the point of view of Public Health Scotland as a body, as an organisation, we will be jointly accountable to Scottish Government and local government. Because we have one of the big challenges about being a national body that has an impact locally. And so therefore, the only way we can do that is in partnership with others, and in fact, that also includes the people who are here tonight. So that idea of us locking into local systems, particularly the community planning partnership, the changing role around public service reform that they've been through, I think gives them a great infrastructure that's already there for us to plug into. So again, as I said here, the big challenge for us as a national body will be to say, how do we fit into local systems? And I suppose that one of the things that we've been very conscious of is when you're talking about a merger, you tend to talk about the technicalities of merger as opposed to the idea of, will this have an impact in community and in place? I don't apologise for putting this slide back up again. It's appeared twice already. But I think if there's going to be a takeaway tonight, that we're really thinking about whole system working. Public Health Scotland can't do any of this on its own. It can only be there as a catalyst, as a leader, as a partner, as a supporter for all of the other organisations and people that will have a role in that process. And again, one of the things that's been challenging for us as a board in taking forward our plans for corporate governance, how the organisation will run, is that you'll be familiar with some boards and public bodies that have committee structures. And we're thinking, how can we capture the ambition that we have to operate as a whole system in multi-agency? How can we capture that in our corporate governance systems? So one of the things that we've been looking at, and again, it'll be for the new board when it comes in, is to actually establish a place in our corporate governance system that is for multi-agency, a multi-agency forum. Not out there, but actually at the heart of the corporate governance of the new organisation. That's how we plan to try and get the idea of a whole system working, operational. Again, these slides are now familiar, but it is also about values. I think for us to take things forward, it will be how we do that as much as what we do. And so that will be a big test for us in living up, again, to these values. So here are some of the milestones. Oh, that's a slip of the tongue. Milestones. I've been around so many of these things where you have, what are your milestones? And you find when you haven't met them, they've become milestones. But on day one is scheduled for the 1st of April next year. But I'm really pleased to say that we're well in advance of that, that sitting just at one of the tables at the back there is Angela Leach, who will be shortly the Chief Executive of Public Health Scotland. And she'll be joining us from East Lothian Council. tremendous experience in leadership. So that gives you a sense of the flavour of the leadership of Public Health Scotland. I mentioned, again, plugging that we'll have the board. That process is already underway. The applications closes on the 1st of November, the shortlisting on the 18th of November, and I've got a large number of days of interviewing throughout January. And with a fair wind, we will actually have an interim board in advance of day one. So, just for the record's sake, my bit's going well. Anyway, thanks for that. So, get to know us, keep in contact with us, and thanks ever so much for taking time out of your busy schedules to be along for this evening's session. Thank you.